So this PowerPoint talk about the healthcare delivery and economics. In this PowerPoint, we get some discuss the implications of healthcare rationing from an economics perspective. Also, evaluate level of prevention as they related to the human health system. So definitely in this PowerPoint also we will try to find out. So health economy definition. I said health economics definition because health economics apply for economics concept to the healthcare sector, right? Healthcare sector. So let me see the health learning outcome from here. Define the various terms associated with healthcare delivery and economics. Discuss the healthcare collaboration and how it links to the patient safety. So, because in health delivery or economics, we work as a team, right? It is very challenging sometimes because we have to face so many obstacles. And economics, basically health economics, is the study how to allocate the resources and safety of human wants. And healthcare is a massive ecosystem that is driven by the four major groups. Okay, I said four major groups, and they are basically peoples and institutes who provide the healthcare, like nurses, physician, hospital, nursing home, health insurance companies like Medicaid and Medicare. So identify the how most important factors in healthcare delivered and economics. Describe the number of healthcare team and their functions. Describe inpatient healthcare setting and their services. Describe outpatient healthcare setting and their services. Explain two types of rehabilitation services and also distinguish between types of nursing care delivery systems and contact Medicare and Medicaid. Also describe the various type of private health insurance. First of all, here we are going to discuss a little bit about the case management, Medicaid and Medicare. So terminology related to the healthcare delivery and economics. So case management, a type of nursing care system that see each patient as an individual and each situation as unique, right? This is the reason we called patient-centered care, because every patient is an individual. Every patient case is unique. Basically, the role of clinical case manager or management is very essential role. And because when patient come to the hospital, get admission, we try to discharge from the hospital. This is our goal. So reduce the length of stay in hospital by supporting, facilitating, and also prepare them to discharge from hospital, make the bed empty for new patient. So our target is this, right? So when patient is admission, when possible, by managing the case or complexity and also utilizing alternative and community care, it is good to get more people involved in the system, and we have to prepare the patient for the discharge, right? So case management nurse are registered nurses who basically coordinate all aspects of care of individual patients, and they ensure the proper utilizing of services and resources as well. So now here there are two more terminology we supposed to talk from here. One is Medicaid and Medicare. So Medicaid and Medicare are two government programs that provide medical and other health-related services to specific individual in United States, right? So Medicaid is a social welfare or social protection program, while the Medicare is a social insurance program. This is the big difference. So let me read it. Medicaid, a program in which the federal government helps state pay for health care of those with an income below poverty level, as well as certain other individuals. And Medicare, the federal government's health insurance program for people older than 65 years age or those with the certain disabilities or condition. As I told you, Medicare and Medicaid are two government programs. Both of them provide medical and other health-related services to specific individual, right? Specific individual means like people's older than 65 or certain disabilities, conditions. And Medicaid and Medicare, particularly Medicare, it is social welfare or social protection program. But Medicare is a social insurance program. So before to go little bit the next page, I want to tell you something. Basically, Medicare, who is eligible or eligibilities? The people who over 65, here over 65, people with disabilities, people with end-stage renal disease, they are eligible. Whereas Medicaid eligibilities are low-income individual and families. So about the coverage, if you ask me, Medicaid, basically hospital services, physician services, laboratory and X-ray services, home health services, Medicaid provide. But Medicare, they cover hospital service part A, medical care part B, and prescription drugs we call part D. Medicare provide. Whatever, if you ask me what are the costs we need, so Medicaid basically no cost. It is potential the co-pay system. Whereas the Medicare a low monthly premium or deduction, right, for hospitalizations, also potential out of the pocket cost. So now question enrollment. So basically Medicaid, so available at any time, but Medicare, it is the enrollment usually October 15 to December 7th or 3 months following 65 after 65 birthday. So go next here, primary care physician. And what is the third party prayer. So primary care physician means a physician paid a set amount per month, per number, per month to manage the health care of those members, right? And third party payer means a party that pay the bills of a beneficiary card for by a physician or hospital. When the bill is sent to an insurance company, the insurance company is referred to as a third party or third party payer, right? So go next. So Affordable Care Act for 2010 was created to solve. So what are the step by step in Affordable Care Act of 2010 was created to solve, right? So basically, uh, this Affordable Care Act, shortly called ACA, is a landmark law that is aimed to reform the US healthcare system and also expand the cover of millions of Americans. So it is very important to know, right? And basically, this Act 2010 was passed by the Congress and signed by our ex-president Obama. And also now we are going to see what are the three main major goals. One is lack of health insurance for many, deny the coverage due to the pre-existing condition. One costly employee illness or injury could cause the huge rate increase for small businesses. Lifetime limit of coverage, and people who needed insurance most were least likely to have it. Hmm? So, what is our main goal in this Affordable Care Act? To make the health insurance more affordable, also more accessible, to improve the quality and efficiency of healthcare, and also to reduce the healthcare spending. This is our main goals to continue this act. Now, going to talk about a little bit here, what is provision of phase 1 and phase 2. So before to go phase 1 and 2, I want to share with you what is the primary care phase. So primary care phase we characterize by the primary care and specialty physician appointments. So in the phase in which the most of US receive our medical care most of the time. And this primary care phase or phase 1 or phase 2 is the paid for by both private insurance companies and Medicare, right? So let me read it. Some preventative services are free to consumer. Young adult can stay on patient's policy until age 28. So it is make easy. Also tax breaks for small businesses to pay for insurance. No lifetime limit, right? No lifetime limit. And no deny due to the pre-existing conditions, and all American must have health care by 2014. So we need new one, right? Because now we are 2023. So healthcare exchange, sometimes we call, I mean, health coverage exchange. Both are same. Basically, it is new provision allow for clear, fair competitions for consumer to buy the insurance. It is believed that this competitions will decrease the cost of premium for consumer. Not all states will have exchanges. People in these states will automatically be enrolled in the federal program. So healthcare exchange basically created by Affordable Care Act and Act are scheduled to start enrolling the participant, particularly in October and many, and believe the success of Affordable Act Care Act is largely depends on the success of these three marketplaces. Okay, so healthcare exchange basically to understand some of the challenger exchanges faces in enrolling participant, also resonate the analysis of extensive uh, data set to individual motivations and that we use to gain consumer understanding and deliver the target online media. So basically there are so many business company in between, so it is not a only act, also there's some marketing information is important. So healthcare insurance exchange or coverage exchange, uh, or otherwise known as the health insurance marketplace, health insurance marketplace, yeah, I believe everybody know about this, is a it is a uh, it's a comparison shopping area for health insurance, right? Also, private health insurance company list their health plan with the exchange, and people uh, compare the shop on exchange from among the available healthcare plan what they provide. So at least there's more opportunities people can enjoy, or they can compare and contrast with others. So now going factors guiding the patient care decision. One is medical necessity and appropriate level of care. So what are the factor guiding, right? So patient related factors, including the patient socio-economical status. It is very important, right? Like patient age is important, patient gender is important, adherence to the treatment, inappropriate behavior, chaotic lifestyle, frequent non-attendings for follow-up appointment, all is the factors, right? All of the factors for patient care decision. So like here are writing very few services view as reasonable and necessary by the provider, appropriate level of care. So navigating the continue to the care, navigating, yeah, doctor office always navigate, but I have to go to the doctor office as well. But if I'm not a good attendance for follow-up appointment, also they will not run behind of me, right? Also, wishes and preferences, attitude and behave, concern and worry, influence of patient's family member and friends, faith, culture, quality of life, all is a factor. But here we wrote few of them. So community and entities for healthcare payment system, right? How we pay the health health insurance payment. So one is Medicare. So government program for the people over 65 or with certain disabilities or medical condition and stage renal disease. Also private insurance, they purchased by individual or employer. So basically, there are few healthcare payment process or company work together. Okay, so there are so many. Um, company work, I said. So here, and now let me see the next. Here, the managing care. We are going to talk managing care, healthcare team, type of inpatient care facilities, criteria for payment and services in skilled nursing facilities, rehabilitation facilities, outpatient facilities, type of outpatient facilities, two type of rehabilitation setting, nursing care delivery systems, team nursing, primary care nursing, and then few questions, right? So let me go one by one, a little bit more discussion. So managed care means any method of financing and organizing the delivery of the healthcare in which the costs are contained by controlling the provisions of benefit and services, right? Okay, so managed care, basically the team manage the care or manage the healthcare is used in the United States to describe a group of activity intended to reduce the cost of providing the health care and providing American health insurance while improving the quality of health care. Okay, so this is basically the goal of managed care. And the most common to most, I mean, the managed care, I said a limited network of providers like professional physician, organizations such as hospital, managing center, pharmacists, laboratories, we always work as a team, right? So managed care means utilizing the management, quality management, financial incentive care for the patient to use the network provider. So all is organized, is the plan of managed care. So next go healthcare team. So healthcare team means who uh, who is on the healthcare team. This is the question, right? Definitely you say medical staff, nursing staff, RN and LPN, then therapy staff, laboratory worker, radiology staff, and also some accessories. So basically, the healthcare team may include radiologist or radiology or lab technician, pathologist, and doctors, nurses, nurse practitioner, general surgeon, oncologist, nephrologist, LPN, RN, all is the member, right, in our team. So basically, uh, the team work together to build an effective healthcare system, right? This is the goal. Now, here is the type of healthcare, type of inpatient care facilities, right? What is the healthcare facilities now? Type of healthcare facilities, basically acute medical and mental health care hospital, the skill of nursing facilities in nursing home or hospital, long-term acute care hospital, and also rehabilitation facilities. You see the acute medical or acute mental health care hospital. So various types of facilities provide inpatient care, include acute care facilities, And acute care facilities basically provides the inpatient services for acute condition, short-term illness, or surgery services for injuries. The different inpatient care facilities and various type of facilities can provide inpatient care. As example, you already know, it is acute care facilities. It is skilled nursing facilities, long-term acute care hospital, and rehabilitation care. So these facilities typically provide inpatient medical care for short-term illness, long-term illness, acute condition, and also surgical services. Now, let me go and see what is the criteria. Okay, so criteria for payment services in the uh, skilled nursing facilities. So now hospitalized 3 days prior to admission. Entrance to nursing home within 30 days of hospitalizations. 100-day maximum per year related to any one hospitalizations and diagnosis. Patient progress documented by medical staff. So there are specific requirements that beneficiaries must meet to qualify for Medicare coverage for skilled care facilities. And this patient must have been an inpatient of the hospital facilities for a minimum of these consecutive days. Okay, so let me go next. What is the rehabilitation facilities? So what rehabilitation facilities do, right? So what does rehabilitation facility mean for, right? This is the information. Basically, rehabilitation facilities is an institute that provide the recovery and treatment care program and services to individuals who sustain injuries and or suffer from the disease. And these facilities provide intense physical, occupational, speech therapy services, may be part of the hospital or a freestanding facilities. Physical specialty oversees patient care, and patients should be capable of participating in the 3 hours of care per day. So this is the facilities they provide, right? And also there are different type of uh, rehabilitation facilities: long-term care, inpatient rehabilitation, skilled nursing rehabilitation, also some kind of role therapy rehabilitations. Now here we are going to see what are the outpatient facilities, right? Outpatient facilities means an administratively district the government, other or public, private, or independent unit or part of such unit that provide outpatient care, outpatient mental health, or outpatient substance abuse services. And that term means outpatient facilities include the Center for Care for Adult or Children, such as hospital, clinics, and day and night treatment center. So what they provide many types of setting, also designed to meet patient medical needs in span of 1 day with return to home following care, usually less expensive than inpatient care. Now here some type of outpatient facilities. So, like hospital outpatient department, outpatient mental health services, cardiac rehabilitations, pulmonary rehabilitations, health departments, physician office, home health care, and hospice. Next, the two types of rehabilitation setting, right? What is that? It may be an inpatient setting for intense physical, occupational, speech therapy, and service such as after a stroke. Maybe a facility that focuses on treating patients with chemical dependency and mental health issues. Maybe an inpatient or an outpatient setting, right? Next here, nursing care delivery system. So what is this? So nursing care delivery system basically, so uh, the two types I said, maybe the facilities that is focuses on treating the patients with chemical dependency and mental health issues. Also, maybe inpatient or outpatient setting. So, the definition of, I mean, okay, so to refer, now let me go next page. The nursing care delivery system. So, team nursing, client-centered care, primary care nursing, and case management. In all of them, including nursing care delivery system. So what are the definition of nursing care delivery system, right? So nursing care delivery system is how work is organized, how nursing staff are deployed, and how will provide the nursing care. And nursing care delivery system in identify who has the accountabilities for nursing clinical outcomes, and this system will provide the organizations, roles, and structure that define responsibilities and accountabilities. And in this system included team nursing. It is the focus is centered, client-centered care, primary care nursing, and case management. So all including all of this. And first of all, team nursing. So team nursing is a care model that uses a group of people led by a knowledgeable nurse. We call team nursing. So it is the delivery approach that provides the care to a group of clients by coordinating a team of registered nurses, licensed practical nurses, and 8 under the supervision of one nurse. We called team leader. So consists of nurses and nursing aides or assistants. It is called UAP or CNA. Used in acute care hospital, rehabilitation setting, and long-term care setting. Each member provide art based on his or her skill, educations, and license. Disadvantage, the fragmented care without proper communications. Now, next to go, what is the primary care nursing? What does it mean? So, one nurse is responsible for all aspects of nursing care for an assigned patient, often used in intensive care unit. So primary nursing is a system of nursing care delivery that is emphasized the continuity of care and responsibility acceptance by having one registered nurse often team with a licensed practical nurse and or nursing assistant. So who together provide a complete care for a group of patients throughout their stay in hospital, unit, or department, right? What are the disadvantages? Work the best with a limited number of assigned patients, does not work well outpatient critical care areas. What next? Next is a one question. So a single nurse is responsible for all of the care of a patient assigned to her in which nursing care system? Number A, team nursing. Number B, primary care nursing. Number C, case management. And number D, none of them. So what is your answer? Number B, right? Primary care nursing. So why? What are the rationale? So in patient care nursing, one nurse is responsible for all aspects of nursing care for his or her assigned patient. So team nursing uses a team consisting a nursing and nursing assistant or UFP to provide care for a group of patients, right? And the delivery of nursing care via a or through a case management system is associated with the managed care strategies. What next? Next here, the client-centered care. So this is our real goal. Whatever we do, everything is patient-centered. They are iconic, right? They are pacemaker. So patient and family-centered care, sometimes we call patient and family care. So empower the client to manage their own care, often seen in rehabilitation setting. The goal in acute setting, decrease the number of caregivers and provide care as soon as needed, right? So patient-centered care always encourages the active collaboration and shared decision-making between patients, families, and providers to design and manage a customized, comprehensive care plan. So the most definition of patient-centered care have the several common elements that affect the health system, right? It is very important because patient are or the family. Uh, so whatever it is, our real goal or real target to the patient care, it is important. Okay, so take our time when we deal with the patient. Okay, so patient-centered care is about the treating the client as they want to be treated or with knowledge about and respect their values and personal priorities. This is very important. So what are the disadvantages of it? The time and education needed to cross-train for all areas. Yes. Next, here we are going to talk case management. So associated with managed care strategy, nurses act simultaneously as a coordinators, facilitators, peer advocate, and educators. System found in hospital, rehabilitation facilities, home health agencies, and worker or company agencies, right? Disadvantage said option may be limited. So if I say the definition of case management is the planning, processing, monitoring of the healthcare services given to a patient by a coordinated group of healthcare providers, right? So case management is designed to provide for a patient's need while control the cost, with case manager maintaining information on a patient outcome. So case management basically consists of case manager lead or counseling center, care coordinator team, also Center for Students with Disabilities, and Care Management Working Group. What next? The method of payment for health care cost. Public health insurance, one. Provide health insurance companies, insurance for special populations, and also charitable organization or self-pay. Sometimes we say out-of-pocket pay. So now Medicare program. Medicare has a 4 parts: Part A, Part B, Part C, and Part D. First of all, Part A. So insurance for hospitalizations and home health and skilled nursing facilities. So Part A, inpatient hospital care, skilled nursing services and hospice care. Part B, supplementary insurance to pay participating provider. So Part B basically doctor's visit, outpatient hospital services, durable medical equipment, and also physician administered drugs include Part B. Part C, Medicare Advanced Plan, administered by private insurance companies. So Part C, Medicare Advantage plans, which combined Part A and B. Or Part C may cover vision, dental, and hearing aid or services. And Part D, Medicare prescription drug coverage. So prescription drugs coverage only Part D. What next? Next year, population assist by Medicaid. So poor and medically indigent individual, pregnant women with income is below the poverty level, children meeting certain income level requirements, also certain disabled individual meeting income level requirements. So they are the candidate, right? They are the person we provide Medicaid. So common type of health insurance program. So health maintenance organizations, then preferred provider organizations, and also point of services. So here only few we talk insurance program, but there are something more like preferred provide organization, health maintenance organizations, high deductible health plan, point of service plan, and executive provider organization plan. There are some few, but we just put some of them here. Health insurance plan for specific population. So one of is called TRICARE, means active and retired military services member and their families. Another one for veteran veteran of military services. It is called CHA MPVA. And worker compensation means people injured on the job, they can provide it. Disability insurance, people who cannot work due to the disabilities set for them. So now one of the question, a patient enroll in a health maintenance organization can look for care for physicians who are both in and out of the network. Is it true or false? What you say? It is false. Why it is false? Because health maintenance organizations is a capitated system requiring the insurance person to maintain within the network. A point of service system is similar to a HMO system, but is not capitated, and the insured can seek services in and out of the network. So here is one more question before to finish this chapter. So after today's, a patient hospitalized for placement of feeding tube due to the cancer of the esophagus must be transferred to other facilities for further care. Which of the following facility would be the best choice for this patient? Number A, assisted living facility. Number B, long-term acute care facility. Number C, acute medical healthcare hospital. And D, skilled nursing facilities. Answer is D, skilled nursing facilities. Why it is the answer? What are the rationale? So a skilled nursing facility may be associated with a hospital or a long-term care facilities, right? So the skilled nursing facility, shortly called S&F, provide a less intense level of care from that found in a traditional or long-term acute care hospital. It is usually a transitional care setting and consists of the skilled nursing care and physical, occupational, and speech therapy as needed. This is the reason we chose the number D, skilled nursing facilities. So this is the PowerPoint for now. Thank you so much for your consideration.